Hello and Assalamu alaikum. My name is Salma Mahar and I'm a consultant dietitian working in UK for the NHS and at Imperial College. And today I'm going to be presenting a lecture on Ramadan education and online learning. So my presentation today will be considering the current structure of diabetes education and how this has been transformed onto an online platform with the DAR and SAFA applications. We're also going to be reflecting how our practice has changed online education through the collaboration of the DAR and My Way Diabetes Education Online. And then finally, we're going to be talking about the DAR RMP Dietitians Network, which is expanding, and the work that they've been doing globally to improve the knowledge and the awareness of the DAR guidelines. So I'm going to start off by asking you all that why is there a need for tailoring Ramadan and diabetes education, particularly via diabetes digital platforms? As we know that diabetes and Ramadan have been a program that we've been talking about for several years. And we know Ramadan is a special time for Muslims globally, all around the world, where they'll be celebrating with their loved ones. And also food is the cornerstone of Ramadan. So it's important that we do tailor the advice according to people's cultural needs and also people's understanding. If we just reflect on how the previous Ramadan has been, the first thing that comes to our mind is the type of foods we eat, the feasting, the family times. And that's why it's really important that we do think about how we're going to tailor the advice for our patients living with diabetes as well. There have been a number of studies that have reflected on the need for cultural awareness and tailored education during Ramadan pre-education. There's a recognition that people eat differently in different cultures, and we need to understand and tailor this advice according to people's culture. And also that we need to be aware of the way people eat according to their customs and also the time management as well. Because people living in the UK might not necessarily be fasting, the patterns of eating are slightly different to how people in the Far East or in the Middle East might be doing according to the working patterns and also the social lifestyle as well. We also need to be aware of the type of carbohydrates communities are eating, because this can have a huge impact on our diabetes and blood glucose control during the month of Ramadan. As you all might know, that the DAR RMP has been instrumental in conducting Ramadan nutrition plan over the last 10 years. And recently, the guidelines have been updated. I've been fortunate enough to be supporting my colleagues, Dr. Nisak and Dr. Salma, on the RMP guidelines. And what this does is that it individualizes care for people around the globe, particularly the Muslim communities where there are majority Muslims. And if you have visited or not visited the DAR Ramadan RMP, I would advise you to and have a look at how this has been specifically tailored to individual community needs. Now, my colleagues will be talking a lot more about the use of RMP DAR online website and how this has been tailored according to the RMP nutrition guidelines. If we have a look at the global presence at the moment, it's been expanded to a number of countries where we have individualized, tailored nutrition plan according to the RMP guidelines. But today we're going to particularly be focused on the new applications that are supporting both healthcare professionals and people living with diabetes across the globe. As we know that digital technology and the use of diabetes learning has become a lot more popular since the COVID-19 pandemic. People are much more familiar with the use of applications and also the use of applications to better manage their diabetes care as well. And the DAR SAFA app is just another example of how we can help people living with diabetes to better manage their diabetes and improve their knowledge of healthy eating. If we have a look at this DAR SAFA app, it brings the content of the website onto your mobile phones. It will also allow people to educate themselves pre-Ramadan or during Ramadan or post-Ramadan about nutrition, and how they can implement this during Ramadan. It gives people the option to actually create nutrition plans, and it also allows this in different languages, which includes English, Arabic, French, Urdu, and Turkish. This is particularly useful where English is not readily spoken or read. If you have a look at the drop downs on the application, it will allow you meal preparations. It will allow you manage your eating habits. Also has content on weight management, and it will give you examples of your specific Ramadan plates according to your cultural needs. As we know, over the last couple of years during the COVID-19 pandemic, things have changed dramatically for both healthcare professionals and people living with diabetes. We know that currently that the use of the Dar Safa app has not been well tested or recognized in the global Muslim population. But what we do know is that diabetes self-management had to be seized face-to-face, and we had to quickly learn how to offer education during COVID. And virtual settings became clinical settings for healthcare professionals and for patients. And patients very quickly learned how to use digital applications and also virtual settings to talk to healthcare professionals and also to manage their diabetes. What we also know is that post-COVID, people are continuing to prefer online learning and prefer to meet with their healthcare professionals online because they've become more familiar, and also it's become a more flexible and a more practical scenario for many people who are working long hours, who are not able to travel to clinic, or who would like more flexibility on when and how to manage their diabetes. We know that there are a number of studies coming out talking about online courses, online management, and also recently there's been an abstract published on diabetes and Ramadan facilitating online education for people living with diabetes during the month of Ramadan. There have been a few studies that have also shown us that how technology can actually improve diabetes self-management, and it can not just improve our clinical outcomes such as HbA1c, but also diabetes efficacy, diabetes management behavior, and also empowering people to self-manage their own diabetes without having to travel or have to come to see their healthcare professional for every concern they have with their diabetes. So I'd like you to bring to your attention a new concept with an organization called My Way Digital Health, who've collaborated with DAR to think about how we can bring education to e-learning for Ramadan pre-education. And they've come up with a concept called a massive open online courses, which is also known as the MOOC, which offers people online e-education learning. This is very common with healthcare professionals, where you've been doing your online annual education that we have to do to tick box exercise, but it was limited for the use of patient education. During the COVID pandemic, a number of online education courses were set up by My Way for type 1 diabetes, type 2 diabetes, and now there were talks to how we could bring Ramadan education online as well. What we have seen over the years during the pandemic, that there has been a significant uptake of people wanting to register, start, and also complete online learning through mass online courses. In 2022, DAR collaborated with My Way to come up with the first ever online education course, which was developed with the RMP nutrition dietitians. And together we came up with a course that was run globally across was free of charge, and it was run in 3 languages. This included Malay, Arabic, and English. And it also included 6 live expert sessions that were conducted with healthcare professionals, including clinicians from the DAR team, as well as myself, where we conducted live Q&A sessions as well. The course was then evaluated both pre and post as well. The course was tailored according to the cultural needs, and what we saw that this was an easy access for people to use. It also improved knowledge of diabetes care, and it also allowed people flexibility to learn about pre-diabetes management anywhere, any time of the day. As you can see here, we tailored cultural advice according to people's cultural needs. This was developed in collaboration with our DAR RMP guidelines, as well as the dietitians developing specifically 10 days Arabic meal plans, which was then shared on the MOOC for those individuals joining in from the Middle East. And this is a very visual method of engaging with patients and healthcare professionals as well. From our learnings, what we've decided to do in 2003 is that we will continue to offer this online education course for both healthcare professionals and for people living with diabetes, caring for someone with diabetes, or would like to learn more about diabetes management during Ramadan. We've decided to separate the course so that those individuals who are living with diabetes will get a much more simplified version in comparison to healthcare professionals. And this course will be live from the 1st of March. Here is the link. You can use this, but it's not currently active. But during the first week of March, it will be live for you to register free of charge and also to promote with your patients as well. I want to bring another concept which has become very popular in the usage of management of type 2 diabetes, type 1 diabetes, as well as gestational diabetes, is the carbs and cals application as well. And we've been working with the Carbs and Cows application to upload a number of Ramadan foods to support people living with diabetes so that they can also better manage their diabetes along with the courses that we're providing as well. And the benefit of the application is that it will bring in foods which people are very familiar with. If they already have the app, then they can enter the foods that they eat, calculate the carbohydrates, and also understand portion control and the concept of how these foods impact your blood glucose levels as well. Lastly, I want to recognize the DAR RMP Dietitian Global Network, who have been working behind the scenes actively to support the DAR RMP and also promote this globally with healthcare professionals. I'd like to introduce Dr. Khatun Nisaq, myself, Rabia Imtiaz and Shahreen Ansar from Pakistan, who've been working actively to promote the DAR RMP guidelines, and would like to also welcome other members of dietitians from globally to support this network as well. If you are interested in joining, please do get in touch with us. We will be more than welcome to listen to your feedback and comments. Just to share with you where we are with the Dietitians Global Network. So the aim of this group is to promote research, so improve research in diet and pre-Ramadan education, promoting education with healthcare professionals of the DAR guidelines. Like you've seen, we are actively promoting the SAHA website as well as the application, supporting knowledge of healthcare professionals where they have very little or limited knowledge of pre-Ramadan diabetes education. And we're actively updating the DAR website with new RMP meal plans as well. Our future plans are also to promote the Train the Trainer program and expand connections with dietitians globally. So currently our projects involve updating the RMP for Bangladesh and Pakistan, where we have created new RMP plan and will be uploading this onto the DAR website as well as the DAR application. We're also conducting healthcare professional surveys of their knowledge of the DAR guidelines, particularly around nutrition and the RMP. And this particular research has started in Pakistan, Malaysia, and the UK. We're also in the process of updating the Ramadan and Diabetes MOOC, as I mentioned, separating the patient and healthcare professional courses. Our future goals and plans are to recruit more dietitians, nutritionists, diabetes educators onto the platform, and also inviting them to share their experiences and how we can support them in their countries. We also like to call on people developing locally culturalized RMPs across Muslim countries, or if you would like to expand on your RMP, we would be more than happy to support this. We would like to improve the use and the effectiveness of online learning by promoting it further, and also promoting Train the Trainer programs before Ramadan starts. Lastly, I'd just like to summarize that the Ramadan nutrition plan is successfully available on a web-based and application. And it has shown to successfully personalize and tailor meal plans according to cultural and Muslim communities. We are continuously working with healthcare professionals to promote this. And we've also seen from our experience last year that a massive online course can be provided to expand and spread out and reach out to more number of people living with diabetes, caring for someone with diabetes, to learn about pre-Ramadan education online, and the future for promoting and expanding to a more number of communities, cultures, and countries could be through e-learning. Thank you very much for listening. I'm happy to take any questions.